These are the many faces of Huntington's disease, a rare inherited neurological disorder that affects movement, cognition, and behavior. So what exactly is Huntington's disease and what is on the horizon? These are just a few of the questions we'll ask this morning. I'm Erica Vetrini. Join us for this very special program as Access Health goes behind the mystery with an in-depth look at Huntington's disease, otherwise referred to as HD.
It's certainly the thing that gets me up every day. The thing I have the most passion for is taking care of these patients.
Mentally and physically, I would just like to hold on to where I'm at now. I don't want to slip any further.
This is a disease that has been called the most disastrous disease known to man. The cycle of despair goes from one generation to the next, and there's no way really to stop it.
There was just little signs there that I knew something wasn't right. I had no idea what it could be, but I knew something wasn't right.
And I'm very hopeful that in the near future, it is likely that we'll find some way to modify the course of the illness.
Dr. Michael Hayden is a world-renowned expert on Huntington's disease and genetic research. Much of his career has been spent seeking to understand HD, its origins, and its patients.
I'm trained as a geneticist and an internist, specializing in neurology, and have been committed my whole life to making some impact in changing the course of illness for patients with severe neurological diseases. The good news today is that there are ways for us to think about ways to understand the disease, to develop new medications, to potentially stop the course of the illness. We know more about the pathways now than we've ever known. And it is good news because pharmaceutical companies are now invested in Huntington disease.
Dr. Victor Sung currently serves as the director of Huntington's Disease Center of Excellence at the University of Alabama in Birmingham. Today, we'll hear from both doctors as they share with us their expertise, insights into patients' care, and deep understanding of this incurable, complex disease and the families affected by it. Dr. Sung explains some of the basics for us.
The simplest definition of Huntington's disease is that it's a purely genetic neurodegenerative disorder. To unpack those words, purely genetic means if you inherit the gene, you will get the disease. If you don't have the gene, you won't get the disease. So it's caused by a gene mutation. And then degenerative disorder in that it causes breakdown or change in the brain over time. And the symptoms that you get come from the brain being damaged slowly over time. It's a slowly progressing disease. It's not something that is rapidly fatal, like certain infections or certain cancers or something like that. The average time from diagnosis to death from the disease is in the 20 to 30 year range.
Huntington captures it all because it has mental illness, it has movement disorder, it has depression, and there's been till now very little hope that you can change the illness. But I always believed as a scientist, as a physician, and an optimist that there's much we can do.
It is considered to be the second most common of the genetic disorders and is passed down sometimes through many generations of a family.
It's ruthless in its disregard for gender, so it can be passed from a woman or a man to a child who's a girl or a boy, and each child of an affected parent has a 1 in 2 chance of having this illness, 50%.
Typical symptoms are what we call the HD triad. So they're the motor, the cognitive, and the behavioral symptoms. Early symptoms of Huntington's disease most commonly would be some mild chorea or some mild depression, anxiety, some mild forgetfulness. We should approach all three of those key areas as there's something that we can do for them, and certainly we should address all of them.
Most people who are affected with Huntington's have onset in their 40s. But in fact, the age span is extremely variable. You can have onset as a children. About 10 to 15% of people have onset less than the age of 20. And now we're seeing more and more people, as we're living longer, we're seeing more and more people having onset in their 70s and 80s and 90s, and I've just seen some patients who have onset over 100.
For my patients that are presenting between 30 and 45, often they're fairly mild. Many of those patients are still working, and they have some combination of some motor symptoms like chorea, some behavioral symptoms like depression, anxiety, or some anger outbursts, something like that, and milder cognitive symptoms, a little bit of forgetfulness. And our focus, since many of those patients are still working, is trying to keep them working for as long as they can.
We know that the age of onset is determined by the severity of the mutation. If you have a mild mutation, you'll have much later onset. If you have a mutation in the middle range, you have onset in your 40s. If you have a severe mutation, you have onset less than the age of 20.
So staging for HD, we actually define by how much functional limitation there is, if any. So in the mildest stage of Huntington's disease, those patients will still be working, still able to handle money, still able to do chores, certainly still able to dress themselves, feed themselves, and do all the basic care needs. In moderate HD, then you're starting to see some impairments functionally, and usually that's going to be impairment at work, often leading to not able to work or disabled from working, some impairments in financial accounting, those kinds of things, maybe some impairment in chores, things like that, but still usually preserved basic function like bathing, dressing. From a treatment standpoint, we would all love to say that, we improve quality of life and treat their symptoms so well that they never reach the late stages of HD. The reality is that many patients still will reach late stage HD, and that's going to exceed the caregiver's ability to take care of them on their own at home. So late stage HD is often the time when patients will be transitioned to a long-term care facility.
Movement symptoms in HD, as they worsen, can cause significant functional impact on the lives of the patients and their families. We'll take a closer look at that when we return.
Register at hdmotorsymptoms.com to be among the first to receive educational materials and resources.
Welcome back to the special edition of Access Health. Today we're getting a closer look at the hereditary and progressive brain disorder, Huntington's disease. Before the break, we were discussing symptoms of this devastating illness and how the disease affects the mind, emotions, and body. One symptom in particular has always been a signature movement disorder in HD. Here's more from our experts.
One of the most common symptoms of Huntington's disease is chorea. And in fact, some people refer to the disease instead of Huntington's disease, they may say Huntington's chorea. Chorea, the term, comes from an old Latin word that means dance. So some people describe it as kind of a dance-like movement, but it's really kind of an involuntary, jerky movement that can involve any part of the body from the head to the toes.
What's interesting, when patients sleep, the chorea goes completely away. So something happens during sleep that suppresses all the abnormal movements. It interferes with function. Patients can't do up their buttons, can't do up their shirt, can't do up their shoelace. They walk, they fall, they hurt themselves. It's quite incapacitating.
Chorea, while it's the most common of the symptoms overall, and certainly the most common of all the motor symptoms, there are many other motor symptoms as well. Other motor symptoms of Huntington's disease besides the chorea would include impairment of eye movements, impairment of speech, impairment of swallowing, impairment of gait and balance.
Today's story comes from rural Alabama. Mike and Myra Smith have been married for 44 years. Mike's diagnosis came in his early 60s, just a few years ago. He didn't know it ran in the family.
My name is Myra Smith. We live in Hartsville, Alabama. We have two sons. Chad, he is 39, be 40 this year, and Ben is 35.
I'm Mike Smith, and I'm 65 years old, working on 66. The Jim Dandy pet food company is being built in town, so I've been there for almost 40 years. I was their environmental and safety officer, manager, so I handled all the safety and then the environmental programs in the site, and we, had a good tight ship.
The first thing I noticed, I guess, related now to Huntington's, was movement in his feet. we would be sitting together on the couch and he'd have his feet up against me and his toes would be constantly moving. And I was like, stop it, please stop that. Well, he couldn't stop it. And I mentioned him going to the doctor, but he didn't think it was a problem, so time went on. And then I noticed when he would sit like over in the recliner, constantly moving. He was beginning to move a lot more and more all over, not just his feet.
The most outwardly visible symptom is the chorea. So many mild patients, they just have the chorea and they really don't have much of the other cognitive or behavioral symptoms. So that is one way that patients present. They have this chorea. It may or may not be that bothersome to them, but somebody has noticed it, somebody in the family has noticed it, or their GP has noticed it or something like that, and they'll initiate the referral.
About 2 years ago, the movement disorder started going, and just where I was unconsciously it wasn't hurting me, but I was fidgeting, I was moving, and like I said, it doesn't hurt you, but everybody else watching you just worry. I finally said, well, no, I didn't. My wife reminded me that we probably need to look into it, and that's when I started looking.
I also noticed him walking through the house. He began to walk differently than he used to. His gait was different. He was stiffer. There was just little signs there that I knew something wasn't right.
Irregular, uncontrolled movements, if you have a little jerk like that in the leg or in the foot, it can disrupt walking fairly simply. I think if you think about a baby that's trying to learn how to walk, how much it really takes for them to walk consistently without falling. You really need very smooth, very consistent movement of the legs that is not interrupted and very coordinated in order to walk well without falling. So it really doesn't take much of a disruption to disturb walking, and which can lead to stumbling or near falling or fallings.
What led it all to me looking further was we were traveling to a football game that Ben was in coaching, and I remember, and I was just real agitated, and Myra really didn't say it. It didn't take much to set me off, but I was really verbally very abusive to her. And she didn't deserve that. I used to be better than this. I didn't grow up that way.
Going and doing as much as we were and working full time, that was stressful. It was a stressful time. But still, some of his actions were not characteristic of him. Some of his outburst was not characteristic. And he did see his MD for some of the emotional, and he put him on an antidepressant. Well, that helped for a while. But then it began to build up again. And that was about the time that he was diagnosed with the Huntington's, and we began to put the whole story together.
The job I had was pretty task-oriented, and I couldn't do a lot of the tasks involved anymore. At the end, I was, doing an email, expressing myself. In an email, it took me, 3 hours to come up with, what I thought could write out, type out, and make sense. So, and that's, that's discouraging. That's disheartening. Just me not being able to do my job like I should. It's not me. So I didn't feel like I need to turn it over to somebody else.
As his job was getting harder for him to do, I think the emotions were getting worse, because of the frustration. His doctor at that time said, maybe it's time to see a neurologist. I think I see a little more than I did the last time. So we talked about it and decided that that's what we needed to do, not just stop here, see if there's anything else out there, get another opinion.
The doctor indicator said, I think it's Huntington's, and so a genetic test would have to be performed to confirm it or not.
We confirm the diagnosis of Huntington's disease with a gene test, which is as simple as one tube of blood drawn out of your arm now.
I probably did not do as much internet research as I would have had I had more time. You know, I did try to find out what I could and be proactive and, you know, questions to ask the doctor when we went. But there's not a lot out there for Huntington's. And what we were reading, there's not much you can do.
While there's no cure for Huntington's disease, efforts to improve the lives of its patients suffering from this unforgiving illness, as well as efforts to find a cure, never stop.
I really don't look at the diagnosis of Huntington's disease as a death sentence.
Register at hdmotorsymptoms.com to be among the first to receive educational materials and resources.
Welcome back to this special edition of Access Health. People battling the incurable, rare, and genetic illness, Huntington's disease, and their families having to cope with so many challenges on so many fronts. But that doesn't deter them or the medical community from staying on path with hope for what tomorrow holds. And in the absence of a cure, the goals are clear: to help patients maintain a sense of independence while helping them to maintain and improve their quality of life.
I've known Mike and Myra. I've been their treating physician for about 3 or 4 years now. I think Mike is the classic for a late onset, very mild dose of the HD gene mutation. He has a mild mutation, so he's had onset much later in life.
You know, it was a relief to know that there was a diagnosis for what he was dealing with emotionally and physically, and I think that just knowing that helped.
So a big part of my clinical endeavors are clinically treating Huntington's disease patients and then participating in clinical trials for Huntington's disease.
Going to Dr. Sung, he started talking to us about the clinical trial, and we were very interested in that. He passed protocol for it, and we started on that. Nobody could actually say, yes, he has the drug. They didn't know because it was a blind study. I could see a difference in his movements, and he just wasn't moving as much.
Started through the treatment, it did help me, so I was able to continue my job to hand it over. Now, I think that's for the new meds. I don't think that, I wouldn't have been able to do that.
There are a lot of things that we can do to treat the symptoms and stay on top of it, and I think when patients come in early and are motivated and aggressive, I'll be as aggressive as the patient and the family wants to be, and staying on top of the treatments, both pharmacologic and non-pharmacologic, to try to preserve quality of life as long as we can.
Right now, that's the biggest part of, I think, my caregiving is just watching him, watching out for him, and making sure that he has what he needs during the day to eat, and making sure when I get home that he has eaten, and asking him from time to time, have you had your medicine? Which he's been very good about. But, you know, when is that going to change? Well, I want to be on top of that. I want to know the first time he forgets to take his medicine. I want to know the first time he falls, he trips for no reason, you know. And fortunately, we haven't had that, but I'm ever watchful.
If I'm 65 years old, still this healthy, and to be outgoing and be able to do the things I'm doing, I'm blessed.
Register at hdmotorsymptoms.com to be among the first to receive educational materials and resources.
We want to thank everyone who participated in this story. So incredibly revealing and inspirational. There is indeed so much hope for what the future holds. And for more information on Huntington's disease, head to hdsa.org. And of course, you can always log on to our website at accesshealth.tv.
My father passed away from HD in 2008. And my sister is in the late stage of HD. HD is the worst disease I could possibly have been given. HD has taken everything from him. Can no longer work, and he lost the ability to hold myself. There's no cure, but there's hope. In the battle, against HD, no one fights alone.